I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
What we're talking about today is blood pressure. Boy, is this a hot topic. 1 in 3 adults have high blood pressure. That's crazy. And I've been in practice a long time. I've been in practice about 35 years. And when I was young, I never saw kids with high blood pressure. And now I see kids with high blood pressure frequently. And a lot of that has to do with their weight, has to do with poor diet, has to do with not getting enough the proper nutrients in the body to make the body function more efficiently. And so this segment of the show, we're talking about foods that you can eat that might help lower high blood pressure. Now, eating things like spinach is not going to just lower your blood pressure right away. You got to make this as part of a whole healthcare plan. Chiropractic care has been shown time and time again to be so effective as part of a treatment plan to help reduce blood pressure. Fixing your digestive system, we talked about that in the first segment of the show. It affects something called the vagus nerve. The vagus nerve helps relax the body. If the vagus nerve isn't working properly, the muscles can contract, the blood vessels can contract, and the pressure can go up. So if you have digestive issues, acid reflux, heartburn, burping, gas, bloating, come see us. We might be able to adjust or pull your stomach down away from the diaphragm so that it takes the stress off the vagus nerve, and you'll be able to digest your food more efficiently, and you don't have acid coming up into your throat, which can eat away at your throat and actually lead to things like esophageal cancer ultimately. So there's many, many, many benefits to get the nervous system working, to get the digestive system working, and get on a good diet. Those are the 3 things we need for any healthcare program, including things like high blood pressure. And we're really good at working with patients with high blood pressure. So spinach, I kind of joked about that. Spinach is rich in magnesium and folate, and that can help prevent high blood pressure and cardiovascular disease. You need a snack, sunflower seeds, rich in potassium, magnesium, some good fats. They are a little high in omega-6 fatty acids, but overall, sunflower seeds are going to get Dr. Joe's blessing there. I was raised Catholic, so I can do that. Sunflower seeds can help reduce cholesterol levels, open up the blood vessels, promote healthy blood pressure. It's a good source of fiber, and it's a great snack. Now, don't get them with salt on them. If you're worried about high blood pressure, get them unsalted. Now, when I was young, back in high school, my friends, everybody, typical teenage kids, they'd sit around, they'd smoke, they'd drink. I never had a cigarette in my life, never had a puff of cigarette, anything in my life. And I never liked drinking because I just didn't like the way it made me feel. I felt stupid. And I like being on top of my game at all times, even back then. And so my friends would sit around, and we'd just sit around in a park in Wallington, New Jersey, behind the bowling alley. And we'd had nothing else to do. I would eat sunflower seeds. And they made fun of me. Now, this is way before I ever realized how valuable they are. But my Uncle Skater, yes, I had an Uncle Skater, I had a bunch of uncles. But Uncle Skater would always eat sunflower seeds too, and that's what I said, well, he always eats them, I'll eat them. So little did I know I was doing something good for myself while all my friends around me were doing something bad for themselves. So sunflower seeds might be a good choice. And if you just need something to pick on, you could just eat them, and then you don't smoke either because you have to break the seeds, or you can get them, shelled already. Bananas loaded with potassium and fiber. So, half a banana a day with some coconut water or coconut milk, super greens, an essential source. Bam, what a way to start your day. Tomatoes are loaded with calcium, potassium, vitamins A, C, E, lycopene. Compounds in tomatoes can lower cholesterol, and cholesterol build up in your blood vessels, and that can help combat the development of hypertension in a variety of ways. Lycopene, one of tomatoes' real useful compounds, is activated by heat. So this is one of the things that I always say eat raw, but if you do heat the tomatoes, you can activate the lycopene. But here's the thing. I'd rather see you eat them raw, but if you eat them cooked, that's fine too. So next time you're making stew or chili or something like that, throw in some tomatoes. I only do organic tomatoes. I'm a bit of a tomato snoot. I grew up, my father was, we always had gardens, big Italian family. My grandfather had this huge garden. Funny story. My grandfather used to grow these tomatoes in Bud Lake, New Jersey, and they would weigh sometimes 2 pounds or more. They were huge, and they were so delicious. Thinking about it, my mouth is watering, and they were so amazingly good. And so we didn't know what Grandpa's secret was. No one ever knew. Nobody could figure it out. So after my grandfather died, my father came from a family of 10 kids. They tried to keep the garden going. Of course, it didn't work more than a year or so. But when they were turning over the area of the garden where they found the tomatoes, they hit a piece of metal. So they cleared the area, lifted up the piece of metal. It was the cover to the septic tank. So these tomatoes were growing over the septic tank, getting all this nutrition from the waste, And that's why we grew these monster tomatoes. So I always had to laugh at that. That's why Grandpa had the secret tomatoes. But I won't eat anything but an heirloom and organic tomato because the other ones are just junk. They have no flavor. And trust me, once you start eating heirloom tomatoes or grow your own tomatoes, you'll never go back to the junk they sell in the grocery stores. Broccoli. Broccoli's been found to have a whole host of benefits, including high amounts of potassium and chromium that help regulate blood sugar levels and weight, both related to high blood pressure. Little trick I do for a quick meal. Again, I'm busy just like you are. Bag of frozen organic florets, broccoli florets. I just boil them a little bit. Add some nutritional yeast, which is loaded with B vitamins, which is great for you and energy-wise and a lot of other things. Nutritional yeast, a little olive oil, salt and pepper, mix it up. It's kind of like, broccoli casserole. Real quick, real easy, real inexpensive. And boy, it's spectacular. Once you start eating it, you're like, oh my gosh, this is so good. If you never use nutritional yeast, it's a powder. You can get it at most health food stores. I love it. I use it at least once a day. It's pretty amazing. It has a nice savory flavor to it too, and it's really good for you. So we're talking about foods you can eat to incorporate into your diet to help lower your blood pressure as part of a whole plan. You can't just eat broccoli and say, I ate broccoli yesterday. It doesn't work. One of my coworkers here at the radio station, the TV station, I won't say who he is because he's very, very famous. Every time he has the worst diet in the world. And every time he sees me, he comes up to me, he'll say, hey, Dr. Joe, I had broccoli yesterday. Or Dr. Joe, I ate a salad yesterday. I'm like, you don't have to confess to me. It's okay. I'm not a priest. You don't have to. But he's so excited when he sees me that he says, I think about you when I eat now, and it really is annoying. I said, good. I got to keep you alive. You're a gem here in the world. I want to keep you healthy. I want to keep all of you healthy. So melons are good. They're rich in potassium, cantaloupe, and watermelon, especially rich sources. It looks like a plant-based diet does what? It wins again. Plant-based diet don't lose when it comes to anything. Now, watermelon's also high in citrulline. Citrulline converts into nitric oxide. Nitric oxide opens up your blood vessels. Now, one of the supplements I do recommend, along with the Super Greasy Essential Source and the omega-3 fatty acids, is Dr. Joe's nitric oxide support. And I take it every day, and it's amazing, first of all, how much energy it gives you. I can't take it at night. I got to take it in the morning. And people ask me all the time, they say, Dr. Joe, how does your brain work the way it does? You just can go up and rattle on for hours. My boss, in fact, when I do my radio shows, my boss said, I bet you right now, if I handed you the microphone, you could do a 2-hour show with absolutely no notes. I said, what topic you want me to do it on, Pete? I mean, yeah, my brain works really well. I'm really gifted with that, but I'm not gifted because I have any genetics. I'm gifted because I take care of my brain. And nitric oxide opens up the blood vessels, which helps keep the blood pressure low, but also increases circulation to the brain, the reproductive organs. Men and women, as we get older, sometimes have issues there. All that's great. So Dr. Joe's nitric oxide support's on the website as well, drjoe.com. You want to avoid the high sodium foods. High sodium foods we talked about raises blood pressure. These are processed foods, pickles, olives, canned foods. Trans fats and omega-6 fatty acids. These fats increase inflammation and blood pressure and are found in packaged foods, conventional meats many times. Just read the ingredients. And here's my rule on ingredients. If you can't pronounce it, don't eat it. Now, some of the things, maybe like cyanocobalamin or something you can't pronounce, that's B12, that's okay. But if you can't pronounce an ingredient, don't eat it. Chances are you should be eating it anyway. So try to stay away from those omega-6 fatty acids. That's vegetable oils, that's corn oil, it's soy oil, canola oil, very high in omega-6 fatty acids, which cause inflammation, which can then affect the blood pressure. Sugar, we talked about that earlier. I got to go over it time and time again. A lot of people tune in and out of shows, so I got to cover things sometimes twice. Sugar consumption directly connected to high blood pressure. In fact, some studies show it may have more impact than even a high salt diet. So giving up the sugar is so important. And you've heard me talk about that so many times in other shows. Caffeine, of course, caffeine can raise your blood pressure. Be careful with that caffeine. I've done shows on coffee. You can go to our website, drjoe.com. I did a whole 2 hours one time on coffee. So you can listen to that. Alcohol, it's a diuretic, which means what? It makes you pee. So as you pee out, the volume of your blood shrinks. And so that can raise the blood pressure as well, because the muscles have to contract harder to pump the blood through it. So we did shows on alcohol too. It's on the website, drjoe.com. Now, some lifestyle tips, not just nutrition, but lifestyle tips. So you're wondering how to lower your blood pressure aside from changing your diet. Reducing stress can lower your blood pressure. And again, we talked about the chemical, physical, and emotional stress. Physical stress, how many people have pain? Raise your hands. Most of you do. Now, I'm board certified in pain management. I'm the only chiropractor in my state who's board certified in pain management. I'm also board certified in orthopedics, and I'm double board certified in nutrition. So I have 5 board certifications. So patients come to us from all over the world. We had last week was Ghana and the Caribbean and New Jersey, which of course I'm from New Jersey. That's a whole nother planet. So people come from all over the world to come see us because doctors many times don't know what we're teaching them, what I'm teaching you. And that's why these shows are so valuable to you. So the physical stress, back pain, neck pain, shoulder pain, headaches, stop suffering needlessly. Because one of the effects of pain is that it can shorten your life, but it can also raise blood pressure. So come see us if you have pain. You can go to our website, drjoe.com. In the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb, and we can go ahead and get that taken care of for you. Pain, we hope so. So pain's one of them. Digestion's another one. We talked about the vagus nerve. That's something else you got to fix. So physical stress is usually easy to work on. My team of doctors are good at it. You got to take care of the chemical, but I'm giving you advice on what you can do for the chemical. So other lifestyle changes you can make, aside from reducing stress, schedule some more free time. I find myself sometimes so busy with practices and radio and television and life that my staff, especially my one secretary, Kayla, she's kicked me out of my own office on occasion. She said, listen, I've moved around you patients this afternoon. Get out. Go for a walk. I don't want to see your face in here. And I'm like, okay. And then I leave. But I don't want you to get overwhelmed. So scheduling free time and fun time is really important. Surround yourself with encouraging friends. Go for a walk. Instead of going out to a bar for a drink, maybe go to a part of town that you can walk around in. Keep the body in motion. And regular exercise and diet play a large role in the development or non-development of hypertension. Another one of the most detrimental components of our Western lifestyle is the stress. Managing stress includes relaxation techniques, deep breathing, yoga, journaling. I am a huge fan of journaling, and I'm a huge fan of breathing. When I'm in my car, I practice breathing. It's an easy time to do it. Breathe in, hold it, and then breathe out. And you can do 4, 4, and 4 if you want to. 4 seconds in, 4 seconds holding, 4 seconds out, 4, 4, and 8. Just whatever you're comfortable with. But deep breaths in, conscious breathing. Hold it for as long as it took you to breathe in, and then exhale all the way out. And that stimulates the parasympathetic nervous system. And journaling is huge. I am begging you, please, start writing things down. Because if you don't write it down, you're going to forget it. And if you forget it, that creates stress. Now, my staff laughs at me. If you look at my car, I have these sticky notes that are sticky all the way across the back, which I think is one of the greatest inventions of all time. And I keep notes on my car, in my office. I have notes next to my bed. I mean, they're everywhere. So I keep notes everywhere. I have them in my pocket. As a matter of fact, last night I had some ideas. I wrote them down and put them in my pocket right here. So write down things. It's going to make your life a lot easier. If you're computer savvy, you can get software programs. You can just make a list of things you need to do. But that's going to take so much stress off your body. And that's the emotional stress that you can handle. Art therapy might work. You can raise your blood pressure to alarming levels just by thinking about stress or stressful events. Imagine events that have such a negative psychological effect on you, chances are your blood pressure is going to go up. Post-traumatic stress disorder, that's something that we have to look at as well. If you have post-traumatic stress disorder, I strongly recommend that you get counseling for it. So you want to do some lifestyle changes that are going to help as well. Now, you want some more foods, help lower blood pressure? I know everybody wants that. Somebody says, Dr. Joe, what else can I eat? How about pomegranates? I love pomegranates. We used to what do we call them? Something apples, Chinese apples? I don't know, I didn't even know it was called a pomegranate when I was a kid until I became an adult and somebody said pomegranate. I said, what's that? So I think we used to call them Chinese apples. I don't know why, I have no idea. Most traditional fruit are laden with sugar and usually devoid of useful nutrients, especially the fruit juices, but 100% pomegranate juice is actually one of the healthiest juices on the planet. It's one of the most desirable benefits you can get from a juice, pomegranate juice. It includes the ability to help lower blood pressure naturally. Now, the science is this. Pomegranate juice is a major blood pressure lowering ability because of short and long-term studies that have proven this time and time again. It's also been tested for its ability to reduce blood pressure in patients with diabetes, patients undergoing kidney dialysis, and those with carotid artery disease, all with the same successful results. Now, I like to eat the whole fruit, and so it's a little tricky to peel. You can go online, look up how to peel them. It's a little tricky to get those little seeds out. But when you eat the seeds with it, you're going to have fiber as well. And again, I always try to do food as natural or whole as possible. Coriander, which is the seeds of a cilantro plant, if you don't know that. Subject to relatively new research, coriander has been used traditionally for many years to treat a number of conditions. In one study, a revolutionary study began attempting to define what exactly the coriander can do. Researchers found that it exhibited several positive benefits, including a hypotensive, blood pressure lowering effect. So start using coriander as a spice. It's pretty good. Pistachios. I've talked about sleep in the past. The pistachio studies have shown 3 or 4 pistachios before going to bed might help you sleep better. I've tried this. I didn't see much of a change, but other people have seen great changes. So it's not just a snack. Pistachio nutrition is no small thing when it comes to heart health. Nuts tend to have a positive effect on lowering blood pressure, generally, overall. But when compared to other types of nuts, pistachios came out on top. Pistachios are the top list of foods in help lowering blood pressure, even those for suffering from high cholesterol. So try eating a handful or two of pistachio nuts every day. They taste great. And if you have them with the shell, it gives you something to do, which kind of wastes time a little bit too. Now, you might have heard about beetroot juice. There's a lot of studies out there. It's been said it can help maintain healthy sex drive, blood detoxification. Now, the juice, referred to as beetroot juice, has been used since the Middle Ages to help treat a number of conditions. However, it's not just a folk remedy. The beet juice is now being researched, and extensive research shows that it has a lot of health benefits, not least of which being helping lower blood pressure. Beet juice significantly reduces both systolic and diastolic blood pressure. Now, interestingly, beet juice had more immediate hypotensive effect than the cooked beet. So in overweight patients, obese patients, that seemed to work better, the juice, than actually eating the beet. Now, I still say eat the whole beet because it's more of a whole food. Past middle age, the effects are not as noticeable, at least in the short term. But here's the thing. Beet juice or beets are high in nitrates, and nitrates convert into nitric oxide. Dr. Joe's nitric oxide support is citrulline. It's a super concentrated form, so I find it's way more effective than beets and beet juice. There's even powdered beets out there. I find it's way more effective, the citrulline, and the results I've seen in my practice are superior. So I would recommend eating beets, absolutely. When I do a show in February, it's the only show I ever repeat every year, and it's called The Food Romance Connection, How Food Affects Your Love Life. And I always talk about arugula and beet salad, because arugula and beets are high in nitrates, and they convert it to nitric oxide, increases circulation. So when it comes to romance, that might be a very romantic salad to have. Add some apple cider vinegar as well, and then a little Dr. Joe's nitric oxide support. Sprinkle some of that on there. Oh, it's good stuff. But the nitric oxide support is I find more effective than the beet juice, and that's on the website, drjoe.com. Olive oil, of course, I'm Italian. I got to throw the Italian things in there. Since biblical times, olive oil has been regarded as one of the healthiest staple foods, especially in areas where it's grown, of course, where it's used a lot. It's a common part of the Mediterranean diet. Of course, it's grown in the Mediterranean. If you've ever been, I've been in the Mediterranean on numerous occasions, as far as the eye can see. I mean, literally up and down hills everywhere, olive orchards everywhere. Really amazing to see how many olives they grow there. In fact, I even have an olive tree at my house. It's small, so it hasn't grown any olives yet. But I thought, I'm Italian, maybe I'll grow some of my own olives. I don't know what to do with them if I grow them, but I'll have them. Well-known diet associated with longer lifespans is the Mediterranean diet, and less instances of common diseases like heart disease if it's an antioxidant-rich, delicious cooking diet with some olive oil in it. Now, don't do a lot of olive oil, but using it, if you have to use an oil, it's not a bad one to use. It can be used in a lot of recipes. It's a good thing because it helps lower blood pressure. 2015 scientific review conducted in Spain found that olive oil significantly reduces the risk of cardiovascular disease and cardiovascular events. So don't be drinking the stuff, but if you're going to put it on salad or something, I'm perfectly fine with that. So it's good for heart, much broader level than just high blood pressure. Olive oil is one of the healthiest fats. You definitely want to include that in your regular diet. Again, don't drink it. If you're going to use a little bit, that's fine. I'm okay with that. Flaxseed, probably due to the omega-3 fatty acids that are found in it. It ranks at the list of some of the best foods to help lower blood pressure. Again, it's fiber, it's omega-3 fatty acids. It can even lower blood pressure of patients who've already developed peripheral vascular disease. That's a common condition hallmarked by fatty deposits and calcium buildup in the artery walls. Now, as a chiropractor, we take x-rays on our patients often, and many times we see hardening of the arteries. And when we see that, we say, listen, you are not just a chiropractic case, you are now a nutrition case. So we got to get your diet straightened out to clean out these arteries, because if you have it on an x-ray in your abdomen, which we usually see it, you also have it in your heart and your brain. So you're skyrocketing your risk of heart disease, stroke. Don't take that chance. Hardening the arteries is, I would say, almost always, if not always, nutritionally based. And that means almost 100% of the time, you can reverse it with nutrition. And I've seen people reverse it all the time when they follow our advice. It's diet, it's chiropractic care, it's fixing the digestive system. That's a healthcare plan. Nervous system, digestive system, and nutrition working properly is the best healthcare plan I can give you. It's not health insurance, it's a healthcare plan. Health insurance is only for treating sick people. I want to get you well. So if you have neck pain, back pain, shoulder pain, digestive issues, nutritional concerns, come see us. You can go to the website, drjoe.com. You can find out where we are in the Atlanta area, Marietta, Duluth, Stockbridge, and West Cobb. We'd love to have you as a patient. We work with almost all insurance companies, car accidents. I've never seen a car accident ever where the car was damaged and the occupants weren't. If the car was damaged, you were damaged 100% of the time. You need to see us right away. And don't get scammed into some scam treatments or, getting jiggled around by the insurance company saying, oh no, we're going to give you a settlement right away and here's $500. And no, get yourself well. Nothing is more valuable than your health, trust me. So flaxseed, back to flaxseed, I drift away for a little bit. Found when flaxseed is consumed regularly for 12 weeks, that's when I had the best results. Again, buy the flaxseed organic and grind it right before you eat it. Just a tablespoon or two. Don't take too much. It can actually clog up your colon and cause problems. Scientists have been so impressed by these transformations with flaxseed that a 2013 study in Canada said that flaxseed reduced one of the most potent antihypertensive effects, had one of the most potent antihypertensive effects achieved by dietary intervention. Celery is great, new trend right now, celery juice. You probably know that it's been said you burn more calories than it gives you, but it's so good because it's great for high blood pressure. Every time you eat celery, the nutrients help keep blood pressure in check. Now, it's interesting to note that at least one study found that cooked celery had more blood pressure lowering effects than raw. So once again, shake it up. Purple potatoes, if you're going to eat potatoes, purple potatoes are a better choice. Trying to make sure you get a wide variety of colors in your diet. That's why we say eat from the rainbow. The more colors, the better. You're probably going to enjoy trying out these vibrant purple potatoes. If you've never had them, they're loaded with antioxidants, things like anthocyanidins, and that gives that sweet potato its a little color. Purple potatoes have significantly shown to help lower blood pressure. Don't eat a ton of it, it's still a carbohydrate. Another oil you might consider using, sesame oil. Coconut, sesame, and olive are the three that I would recommend. I generally try to stay away from the vegetable oils. Again, the soy oils, the canola oils, the vegetable corn oils, those are loaded with omega-6 fatty acids and are really bad for you. The oil of sesame seeds has been popular in ancient times. It's been used in medicine. And there are some serious heart-healthy properties in sesame seed oil. It can help lower blood pressure and help protect against cardiac hypertrophy, which is when the heart gets bigger. And that's thickening of the muscle walls in the heart. A lot of research focuses on sesame oil's ability to increase potassium levels, which then decreases sodium levels, which then works really well. Now, these effects seem to apply to both short and long-term studies. So cooking with sesame oil regularly can help protect against blood vessel issues in the first place. It has a nice flavor to it, too. Hibiscus tea in small amounts, slightly controversial because in large amounts it could cause a problem. But I don't like hibiscus tea. I don't like flowery teas personally. But hibiscus tea, it's a little tart and flowery flavored. It contains a large number of antioxidants, and it's been found to help with blood pressure. So try it. If you like it, great. If you don't, that's okay. I'm giving you all these options. And that's what I do with my patients. I'll say, all right, these are the options. These are the things I want you to do. If you do all of them, that's amazing. If you do some of them, that's great. If you do one of them, it's better than what you're doing right now. So with patients in pain, come see us. Get fixed. Hopefully we can fix you. If we can help you, we'll tell you. If we think we can help you. We can't guarantee results. Please understand that. But if we think we can help you, we'll help you. If we don't, we'll send you out somewhere else. Now, sometimes patients come see us, they don't listen to our advice. That's okay. I always say there's two types of people in this world. Those we have seen as patients and taken our supplements, and those who we will see as patients and take our supplements. Because once you start getting yourself well, you're going to say, why didn't I do this sooner? Why did I suffer for so long? It doesn't make any sense to me why people suffer. There's no reason why you should be suffering when you have options. Now, sometimes we can't fix everything, but in many cases we can. Now, high doses of hibiscus tea can cause problems too. It's not recommended for pregnant and nursing women. If you're taking certain medications like diabetics, high blood pressure medication, if you're taking malaria medications, but it's something you might want to consider. Again, I'm not a big fan of the hibiscus tea. Now, there's something called the DASH diet, and this is what they talk about to try to lower your blood pressure. And the DASH diet, D-A-S-H, is basically what I've been teaching you all these years. Fruits and vegetables, nuts and seeds. They recommend a little bit of dairy products. I'm not a big fan of dairy products, so if you want to, I leave that out if you can. But DASH diet foods help reduce your risk of cancer, heart disease, diabetes, all-cause mortality is what they call it. So if you're looking for some specific foods, again, the DASH diet is what? Fruits, vegetables, nuts and seeds, pistachios, sesame oil, salad every day, something raw every day. I would add my own Dr. Joe's Super Greens and Dr. Joe's Essential Source as part of the protocol. Because the Super Greens, the Essential Source, the nitric oxide, the omega-3 fatty acids, those are the 4 supplements minimum I would suggest you get on. If you have digestive issues, Dr. Joe's Digestive Enzymes. Whenever I eat a cooked meal, I eat Dr. Joe's Digestive Enzymes, because as I get older, my enzyme levels drop. And the study after study after study have shown that chiropractic care is so helpful in many high blood pressure cases. So if you have neck pain, back pain, vagus nerve issues, digestive issues, just come see us. I don't know how to make this clearer. And every day, patients come from all over the world. Everyday patients say, why didn't I do this sooner? Why did I suffer for so long? I don't know that answer. You have the information now. So if you want to order the supplements, they're online, drjoe.com, drjoe.com. If you're in the Atlanta area, you can come by our offices, Marietta, Duluth, Stockbridge, and West Cobb. We'll get the supplements to you. That'll save you some shipping. And most importantly, just make an appointment to come see us. We work with whatever insurance you have. We're going to do the best I can to work with you. Car accidents, sports injuries. If you work for a company, you need to have chiropractic care on your workers' comp list, because chiropractic is the most effective, least expensive treatment for back pain by far. So again, a lot of information on the website, drjoe.com. Make an appointment to come see us. If you have any questions, send them to me through the website. I'm more than happy to answer you. Again, the website, drjoe.com. Folks, I'm Dr. Joe Esposito. Thanks for tuning in. We'll catch you next time. Thanks for listening to For the Health of It. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on the WSB Radio app.